Okay, so today we're going to talk about education for a patient who has the diagnosis of sickle cell anemia, also known as sickle cell disease. First off, I just want to briefly go over some sickle cell anemia facts before we get into the patient teaching portion of the video. Sickle cell anemia is a genetic disorder that pretty much means it's something that you're born with. It can't be transmitted from person to person. The disease causes red blood cells to become hard and sticky and have an abnormal sickle-like shape as seen here. These cells die early, causing a shortage of red blood cells in the body. Given their sticky nature, they can also get stuck in small blood vessels, stopping blood flow. This can cause severe pain in the affected area, organ damage, and even stroke. Some nursing diagnoses that can be associated with sickle cell anemia are acute pain, risk for infection, and ineffective tissue perfusion. Okay, so for the patient teaching, I will be going over some basic teachings for managing sickle cell anemia for the young adult who would soon be headed off to college. First would be to find a hematologist that's close to your school or a doctor who knows a lot about hematology. Practicing healthy habits. So this is something that's really difficult for college students, but it's very important for managing sickle cell disease. So healthy eating and adequate hydration are very important for these patients. Staying active, but also remembering not to overdo it. Preventing risks of infection. So just remind them that common issues like the cold and flu are potentially dangerous for their condition. So some ways to get ahead of that would be staying up to date on vaccines and hand hygiene as always. Another would be managing stress. This is definitely an issue for college students, especially those choosing to major in nursing. So stress can lead to pain episodes. I would advise them to find daily ways to relieve stress and find ways to cope with stress. Whether that be through taking some time out of their day to meditate, read a book, something that they find relaxing. Another one specific to college students would be to be extremely cautious with alcohol, if not avoid it completely. Alcohol can cause people to lose too much fluid, and for these patients with sickle cell anemia, losing too much fluid can trigger a pain crisis, which would cause the blood to stick in the vessels. And then also maintain medication compliance. So one medication that people with sickle cell anemia would be on most often would be hydroxyurea, and this is prescribed to alter the DNA and prevent sickling of red blood cells. So that would be teaching for a college student with sickle cell anemia, or really anyone. I've also attached a couple of pamphlets from the CDC to this discussion post if anyone's interested in looking into those.